How does central sensitization cause raw chronic pain? Imagine feeling pain that seems to stick around long after the initial injury or inflammation has gone away. That's what happens in central sensitization, a process that can make rheumatoid arthritis pain much more complicated. Rheumatoid arthritis is an autoimmune disease where the immune system attacks the joints, causing inflammation, swelling, and tissue damage. Usually, this inflammation is what causes pain. But in many cases, people feel pain that doesn't match the level of inflammation seen on scans or exams. That's because central sensitization is at play. Central sensitization happens when the central nervous system, which includes the brain and spinal cord, becomes overly sensitive to pain signals. Normally, pain signals are a warning system that something is wrong. But with central sensitization, the nervous system gets hyperexcited and amplifies these signals. This means that even normal sensations or mild inflammation can be perceived as intense pain. It's like turning up the volume too high on a speaker, making everything sound painfully loud. This heightened sensitivity causes widespread pain that can affect areas beyond the inflamed joints. Patients might experience pain in muscles, tendons, or even at non-articular sites, which are not directly affected by joint inflammation. This phenomenon is called hyperalgesia, meaning an increased response to painful stimuli. It can also cause allodynia, where normally non-painful stimuli like a light touch or clothing can feel painful. Several mechanisms contribute to central sensitization in rheumatoid arthritis. Persistent joint inflammation releases chemicals called cytokines and neuropeptides that sensitize peripheral nerves. These signals travel to the spinal cord and brain, where they cause neuroplastic changes. Neuroplasticity is the nervous system's ability to reorganize itself, but in this case, it leads to increased responsiveness of pain-processing neurons. This process is sometimes called wind-up, where neurons become more reactive to ongoing pain signals. Additionally, the body's natural pain-inhibiting systems can become impaired, making it harder to turn off pain signals once they start. Emotional and psychological factors also play a role. Stress, anxiety, and depression can worsen central sensitization by influencing how pain is perceived and modulated. This is why managing mental health and sleep is often part of a comprehensive approach to pain management in rheumatoid arthritis. Clinically, central sensitization explains why some patients report severe pain even when their disease activity appears low. It also helps explain why pain can persist long after inflammation has been controlled. About a quarter of rheumatoid arthritis patients show features of central pain syndromes similar to fibromyalgia, which involves widespread pain and fatigue. Understanding this process is crucial because traditional treatments that target inflammation may not fully relieving pain caused by central sensitization. Instead, a multidisciplinary approach that includes physical therapy, psychological support, and sometimes medications that modulate nerve activity can be more effective. Always consult healthcare professionals for personalized treatment plans. In summary, central sensitization causes rheumatoid arthritis pain to become amplified and persistent by changing how the brain and spinal cord process pain signals. This leads to ongoing discomfort that can be disproportionate to joint inflammation alone, adding to the overall symptom burden. Recognizing this mechanism helps guide more comprehensive and effective pain management strategies for those living with rheumatoid arthritis.